Good evening, everybody, and I promise I will stick to the 8 minutes. He tells me he has an alarm on. So I will speak fast in my Galway accent, and you're very, very welcome. And just thank you, Peter, for inviting us here to present. I suppose the study that I'm involved with is the evaluation of the role of the Epilepsy Specialist Nurse in Ireland. And I suppose just to set it in context, in terms of the National Epilepsy Care Programme, set out a vision for a quality service for people with epilepsy, and I suppose outlining kind of the need to improve access to care and information, to improve quality of care from prevention right to the interventions, and also I suppose to look at kind of value in terms of looking at it in the context of getting conscious ideas around what constitutes value for money. But one of the recommendations within that was that in line with the NICE guidelines, that the epilepsy specialist nurses would be part of the model of care that would be delivered. I suppose there was a vision that the epilepsy specialist nurse would improve the quality of care for people with epilepsy, that they'd improve access to specialist services, and they would improve the patient journey. So we were given a grant to look at evaluating the specialist nurse's role. And I suppose in terms of the three objectives that we were asked or tasked with was one, to identify the role and the scope of the epilepsy specialist nurse within Ireland, to identify the impact of this role on patient experiences and quality of life, and also then to look at cost and cost effectiveness of the role. So they're kind of the three broad objectives. I suppose why is this evaluation an important evaluation? And then of course everybody thinks that their research is an important research piece, but in terms of within the Irish context, I suppose that it's a very new role, and there's very little known about it as a role. And even though we have epilepsy specialist nurses in the UK and elsewhere, interestingly, internationally, in terms of the research that is being done on looking at that role, it's very, very limited. And I suppose, so this is kind of the first comprehensive evaluation. I think the other piece that it's important is that the vision was that the role would be at advanced practice level, and that all the nurses would be educated to master's degree level within the specialty of epilepsy, and so they will also go on and have maybe prescribing rights. So I suppose in terms of looking at then, if we put this role in place, there's questions around, has it improved service provision for the benefit of patients and families? Is it in terms of is it costly, or how costly is it? And I think the other piece, that because not all services within Ireland have an epilepsy specialist nurse at the moment, that the findings of the study is quite important in the context of guiding policymakers into the future. And maybe coming from a nursing background myself, I think it's critical for us to have information to guide the nursing profession on improvements within the role, but equally looking at whether this role and the way it has been configured can be a model for other development of nurses' roles in other areas of chronic illness and chronic disease. So our methodology, and I'm going to give you a whistle-stop tour, was very much, we had sites where they had epilepsy specialist nurses, and then we had sites without epilepsy specialist nurses. And we did quite a comprehensive data collection, so we have lots of data. We did interviews with the epilepsy specialist nurses, with directors of nursing, and with members of the multidisciplinary team, from neurologists to social workers, to psychology, and other people that the epilepsy specialist nurses would come in contact with. We did focus groups with the patients and carers. We went out and we did observations out in the sites with looking at nurses. We collected up documentation that they had been involved in, so we could do an analysis of the documentation. And I suppose we also had surveys to patients that had been attending epilepsy specialist services that had the epilepsy specialist nurse, and then we had patients that were attending services that didn't have an epilepsy specialist nurse. So I just want to, I suppose, highlight 2 or 3 key areas. One, in terms of when we compared the data that's coming back from services with epilepsy specialists versus non-epilepsy specialist nurses, what we're finding is that patients are reporting increased knowledge in the sites with the epilepsy specialist in terms of the nature of epilepsy, safety aspects of epilepsy, and social aspects of epilepsy. Now, interesting, there is no difference on their knowledge around medical aspects. So, and I mean, that is not, I suppose, we kind of expected that because they're meeting medical people in both services. We had statistically different differences in patients' reported involvement in care and in their satisfaction with emotional support and practical support. The other thing one of the other things that we see a lot is that the presence of the epilepsy specialist nurse has improved access to services. They have been key in development of telephone advisory services, which is also in terms of following up on patients, giving people a sense of knowledge about their epilepsy. They have been leading out on the vagal nerve stimulation clinics, rapid access clinics, and also in terms of developing outreach clinics to people in terms of intellectual disability services and maternity care services. And I suppose the other piece that what is clear is that they have been involved in the development of lots of information for people and their families who experience epilepsy. The other piece, I suppose, is one of the findings is easing the patient's journey and reducing patient burden, in terms of that the patients talk a lot about the continuity of care, that they're seeing the same person, that there's a greater sense of that they a coordination of care, that sometimes the epilepsy specialist nurses are key in kind of directing people to services. And I suppose some of the data around communication is quite interesting when you compare what patients say in the surveys and in the qualitative comments in the services without the epilepsy specialist versus the service with the epilepsy specialist. Some of the areas that we've seen the difference is that in the epilepsy specialist nursing services, they're talking about getting much more information around pregnancy, much more greater comfort in discussing sexual health issues with the people they come in contact with, and that their follow-up care and ease of making appointment is much better. So I've just 30 seconds left. So I suppose that's just three areas. We have lots of other data around economics and other pieces that we're analysing at the moment. And I just want to say acknowledge one to the Epilepsy Ireland and the HRB who have funded the study. I suppose the SENSE team, which we have quite a significant number of people from the hospitals and that were involved in us, and our collaborators and some of our research assistants. And I suppose just to say a very special thanks as well to Maura White, who I think somebody said she's here, because she would have been quite helpful to us, and Maura is one of the specialist nurses and advanced practitioners and guiding us along the way. So thank you. I hope I haven't done